Tear osmolarity represents an objective measure of one of the characteristics of the tear film, and modern technology has made this a minimally invasive office diagnostic procedure. Pundits will state that it may change the paradigm for managing dry eye. Detractors will suggest it's another test that doesn't help enough. Our question in this regard was, what does the science tell us? To answer the question, we searched the PubMed online catalog of peer-reviewed manuscripts to find those that were recent, relevant, and included supporting clinical data. Theoretical papers and bench tests, while of interest to the scientists, are perhaps of less interest to practicing clinicians. Armed with our list of 164 relevant papers, we graded them for quality using a number of standard techniques. We also cataloged whether they were positive, neutral, or negative towards the use of tear osmolarity in clinical practice. And finally, to determine if there was an industry bias, we categorized the papers according to whether they received financial support from industry or whether the research was conducted independently. Our review showed that the scientific literature supports the use of tear film osmolarity as an objective measure for diagnosing, grading the severity, and managing the treatment of dry eye. The findings in the articles evaluated here appear to confirm the central role of increased tear osmolarity in the pathophysiology of dry eye disease as described by the Dry Eye Workshop. As an important additional point, the effects of industry bias appeared minimal. While, not surprising perhaps, all corporate-sponsored studies indicated a benefit to the use of tear osmolarity, 93% of the much larger group of independent articles were positive or neutral.